Welcome to the Live to 110 podcast. My name is Wendy Myers, and you can find me on liveto110.com. And you can find this video podcast, a recording of the video of our talk today, on my YouTube channel, Wendy Live to 110, and on the blog post on liveto110.com. Today we are interviewing Dr. Scott Sherr. I met him at the Bulletproof Biohackers Conference, and he is a doctor that specializes in hyperbaric oxygen chamber therapy. So we're going to be talking about the many benefits of this therapy and how you can incorporate it into your health regime, even just for achieving optimum health and for anti-aging purposes. That's what I'm going to be using it for. So first we have to do the disclaimer. Please keep in mind that this program is not intended to diagnose or treat any disease or health condition and is not a substitute for professional medical advice. The Live to 110 podcast is solely informational in nature, so please consult your healthcare practitioner before engaging in any treatment that we suggest today on the show. And so I had a very lively conversation with Dr. Scott Sherr when we were at the Bulletproof Biohackers Conference, and I was lucky enough to be able to try HBOT therapy. There was actually another company that was demonstrating HBOT, and so everyone at the conference was able to try out about 10-15 minute session of hyperbaric oxygen therapy, and it was interesting. And I think I had an ear infection at the time because I felt a lot of pressure in my right ear. Yeah, but I was happy. It cleared it up. I think it cleared up the infection. My daughter was sick that weekend, so I think I was starting to get it, and it cleared it up, I believe.
Cool.
So Dr. Sherr is a board-certified internal medicine physician with additional certification in hyperbaric medicine. He graduated summa cum laude from UCLA and as an undergraduate. And
Go Bruins.
Yes. Yeah. And he also graduated magna cum laude from the University of Maryland.
You're not doing that great, so. You're not doing that great, so.
No. And he also graduated from, actually I don't follow football, so I have no idea. That was an autoresponder. Yeah, and he also graduated magna cum laude from the University of Maryland School of Medicine in Baltimore, Maryland. Dr. Sherr is a member of the Undersea and Hyperbaric Medical Society, as well as the Society of Hospitalist Medicine. He lives with his wife and 2 young daughters in San Francisco. So Dr. Sherr, thanks for coming on the show.
Wendy, thanks so much for having me today. I'm really excited to be here. And yeah, the Bulletproof Conference was great. I really enjoyed having that group next to me because the patients could actually, or everybody, nobody's a patient. Everybody's a patient, I guess, right?
Yeah.
But you guys could check it out. You can see what being in at least one type of hyperbaric chamber was all about.
Yes.
And got to meet a lot of great people, including yourself and Dave Asprey, who's the Bulletproof guy, and a bunch of other great people, great speakers, and some people that I've spoken to over many years and finally got to meet in person, which was great. So.
Yeah, me too. I was so happy to meet him in person. He's come on my podcast and I've gone on his, which is I think it just recently came out. And it was just such an amazing group of people, all converging to try to improve their health. I loved it. It was right up my alley.
Oh, absolutely. Yeah.
Well, so why don't you tell us your story? How did you get so involved in hyperbaric oxygen therapy?
Yeah, sure. It started off, I think, really in medical school. I trained in Baltimore, as you mentioned, and in Baltimore, there's a really big trauma center there. And down in the basement of the trauma center was this gigantic chamber, and I had no idea what it first was when I saw it. It looks like sort of like 1984-ish or something crazy. It's like this gigantic chamber, but then I realized this is a hyperbaric oxygen chamber, and they were putting people in these chambers for any number of conditions from a trauma perspective, including like limb amputation, carbon monoxide poisoning, and necrotizing fasciitis, or an infection that's also called flesh-eating bacteria. And these guys were getting so much better, and I was just amazed that it was all they were really getting was oxygen under pressure. And one of my goals always going to medical school was to try to figure out a way where I could sort of meld the sort of allopathic view of medicine, which is, Western medicine, with what is sort of, there's so many terms for it, but integrative, alternative, all those types of medicines together, And what I realized when I was watching these guys go through hyperbarics, I'm like, well, why aren't we using oxygen for other conditions? And then I did my research, and I was like, well, wow, and all over the world, they're using it for so many other different types of conditions, more so than we're even using it in this country. And that's how I got so interested in it, and that's how sort of my practice started, really. I got certified in hyperbaric therapy when I was actually still in medical school. And when I came out to California, where I live now, I found a place that was looking for a medical director, and I jumped right at it. And the way I sort of practice hyperbaric therapy is I use hyperbaric therapy in an integrative way. It's not just about the chambers, it's not just about the oxygen and the pressure, but it's also about sort of treating the person, right? Treating them as an integrated human being, both sort of alternatively, as well as from allopathic or Western medical perspective as well, depending on what the condition is. So
yeah. So why don't you tell the listeners exactly what HBOT is?
Sure. So hyperbaric oxygen therapy, the definition, if you're going to look it up, is it's the intermittent administration of 100% oxygen at greater than atmospheric pressure. So let me break that down for you a little bit. So now I'm sure some of your listeners are probably divers, right? I think you're a diver too.
Yeah, I am too.
Yeah. So hyperbaric oxygen therapy really comes from diving medicine, okay? It used to be called just diving medicine for a long time, actually. And it sort of got its start when you were building, when people in the 1880s, early 1900s were building bridges, actually. And what they had to do is they were sinking these guys deep underneath the water to build these bridges. And compressed air, or hyperbaric air, has actually been around since the 1660s. What they used to do is they compress the air, put it in these chambers, and these guys would sink down to the bottom of the ocean and dig out these, bedrock to get these bridges to be stable. The Brooklyn Bridge is one of the most famous examples. And these guys would have to be down there for long periods of time, and then they would come up these tubes, sort of like elevator shafts. And if they came up too quickly, they would get these severe symptoms. They would get neurologic symptoms like seizures, strokes, even paralysis, death. It was really described back in the 1880s as decompression illness. That time it was called the bends. People were kind of bent over a little bit, and it's just severe muscle pains and things like that. So that's really where hyperbaric oxygen therapy really came into play, because the Navy started diving, right? So the Navy back in the 1900s started, having sort of like the technology to dive, and they were looking for ways to, prevent decompression illness, is what it was starting to be called.
They were developing the Navy SEAL program.
Exactly. Yeah, actually developing the SEAL program back in like the 1920s and 30s.
Yeah.
That's the time when they actually figured out a way to compress oxygen as well, not just air. And that really was the huge sort of like leap of technology that allowed hyperbaric oxygen therapy to come into play for decompression illness, because you had these guys coming up too fast, getting these really bad symptoms. You put them back in a hyperbaric chamber with 100% oxygen, and their symptoms went away, right? And divers know about this as well. I mean, usually in a lot of big dive areas around the world, the Channel Islands in Southern California, there are hyperbaric chambers right there. They're just in case people do have these symptoms.
Yeah, I learned that. I got certified when I was 12, 13 years old, and 30 years ago. Mm-hmm. And I'd learned all about hyperbaric oxygen therapy, and thought it was really interesting. And it's nice to see it being used more often now as a medical treatment.
Oh, absolutely. And so let me go back to the definition, because I always get sidetracked talking about history. I was actually a history major in college, so I love history. History and psychobiology, by the way. So I had some science background too. But anyway, so when we're diving, right, when we're at sea level, that's called 1 atmosphere of pressure, or basically no pressure, but we call it 1 ATA. That's just the terminology, okay? So if you're 33 feet below the sea, you're actually at 2 ATA, okay? And that's 33 feet of seawater on top of you, right? So all that water is exerting a pressure on your lungs. You don't really feel it because you're sort of weightless in the water, but all that water is exerting a pressure, okay? So, and then we can go down as far as some chambers go down to 6 ATA. So you can do the math. I can't do it on the top of my head, but it can go pretty far down. And we usually don't go that far down in hyperbaric chambers, unless actually it's in decompression illness, depending on how far people have dove down. But regardless, what we're doing in the chambers really is just simulating that pressure, okay? You don't feel like you're underwater by any means. All you really feel is that pressure sensation in your ears when you're going down underneath the surface, like you were going to go down under with a train or in a plane. You feel that sort of popping sensation. You need to be able to pop your ears. That's probably why you felt a little bit of pressure in your ear when you were diving at the conference, Wendy. And as long as you can do that, as long as you can pressurize your ears, that's the only thing that you feel, okay? So now we're underneath water or we're under pressure, right? And the other thing we're doing is giving 100% oxygen, okay? Now that oxygen is not only saturating our red blood cells, but it's also saturating what's called the plasma or the liquid of our blood, okay? So normal people like you and me that don't have any lung disease, our oxygen that we breathe in the air is actually sufficing in our red blood cells enough oxygen to circulate. And if you had a pulse ox on your finger, which is what we use a lot of times to sort of measure patients' oxygen saturation, usually it's about 96 to 100%, okay? So if I get this question a lot, well, why, doc, couldn't I just use like a nasal cannula and get myself oxygen that way? And the reason for that is that you only have like maybe about 4% of those oxygen binding sites on the red blood cells where you can actually carry oxygen any more than you already are. Maybe, for a normal person, right? But if you use pressure, now using the pressure, it's basically putting pressure on the oxygen gas, and by putting pressure on the oxygen gas, you're actually increasing the amount you're actually sort of putting into the liquid of our blood, not the red blood cells. We can get so much oxygen into the plasma or the liquid of our blood, we actually don't even need red blood cells if we get down to below 3 atmospheres of pressure. Now, I don't recommend that, but one of the indications for hyperbaric therapy is actually severe anemia or severe blood loss. And because you can put somebody down at this, this low pressure or this deep pressure, where they don't actually need the red blood cells to be circulating, to get oxygen to their tissues. So it's pretty phenomenal how much oxygen we can get, into saturation. And that's where all the sort of like the catalytic reactions occur, is really that oxygen saturation in the plasma.
And so does that cause it kind of, it's like an antioxidant? It starts destroying free radicals in your body, et cetera. Can you explain that a little bit about how the benefits of doing that?
Yeah, sure. The mechanism of hyperbaric oxygen therapy is sort of what you're leading to right here. So, when we're getting all that oxygen in our body, what is it doing? Really what it's doing is modulating our DNA. It's changing gene expression, and it's increasing genes or sort of promoting genes that are responsible for growth and repair and decreasing inflammation, and also promote and sort of down-regulating or decreasing genes that are responsible for inflammation and responsible for programmed cell death, okay? Not only is it doing that, it's also the direct effect of oxygen on tissue. So, for instance, if you have acutely hypoxic or the lack of blood flow to an area, right, acutely hypoxic tissue, if you have hyperbaric conditions there, you're preventing this cascade of reaction that happens to that tissue, like breakdown, swelling, inflammation, because there's oxygen it's oxygen deprivation. So oxygen has a direct effect on that tissue in the acute sort of hypoxic event as well. And we've seen that in studies now in patients with acute heart attacks actually, and some indications in acute strokes too. If you get them into a chamber right away, you can prevent all this muscle or tissue death in the brain, which is pretty impressive stuff, right? So the downstream of all this gene expression changes include a lot of things. One of them is angiogenesis, which is the increasing in blood vessel formation. That's extremely important in areas that have a lack of blood flow. And there's so many others, but a couple others that are sort of prominent. It increases oxygen tension into the tissue itself, right? So it actually can diffuse further into tissue, which is just about 4 times as far, which, we're talking on sort of a cellular level here. That's a pretty huge distance, okay? Also talking about vasoconstriction, and that's really important. So we're talking about vessels getting smaller, right? And that's really important, especially if a vessel's been injured, because if a vessel's been injured, all the liquid, all the blood sort of starts pouring out of it, right? And causes swelling. And if you can imagine, if that swelling's in your brain, that could be bad, right? So hyperbaric oxygen therapy, what it's doing is decreasing the swelling, decreasing all that stuff getting out of the vessel, okay? And even though it's doing that, even though it's decreasing the size of the vessel, it's actually still, the net is actually that you're increasing the amount of oxygen that's getting to tissue because you've supersaturated that plasma with oxygen, right?
Yeah.
It also causes a decrease in inflammation by itself. It's actually as powerful as steroids are, at least in some studies. Steroids in Western medicine are sort of the cure-all for inflammation, right? Yeah. Hyperbaric oxygen therapy is sort of as effective as steroids, at least in studies. So pretty powerful stuff,
And people don't realize they inject steroids, they're destroying the bones, breaks down the bones surrounding the injection site.
Right. So steroids, there's lots of side effects for steroids. I mean, they do work in some settings when you need them. Yeah. But, long term, definitely if you can do it in a natural way, I mean, that's what we should be trying to do, right? Yeah. That's our aim. So some other things that hyperbaric oxygen therapy does, you spoke about bone. hyperbaric oxygen therapy sort of improves wound healing in every sort of capacity. I think the most important capacity is that it proliferates, it sort of stimulates the proliferation of cells that are responsible for healing. Fibroblasts, which are connective tissue cells, chondroblasts, which are collagen-stimulating cells, osteoblasts, which are the bone-stimulating cells.
Yeah, I need some more chondrocytes.
We all do.
Definitely want some more of those.
Once we get to be about 30 years old, we all need more chondrocytes.
Yeah.
Right? We all need, osteoblasts are important too, especially, women. Osteoporosis is a big deal. And the idea is that what hyperbaric oxygen therapy is doing is really promoting the healing process by allowing these cells to proliferate. And it's doing that also by actually increasing stem cell production too, and making those stem cells go to the areas of injury, which is really, really cool stuff. Other things that we're doing here include what else we have? Mitochondrial enhancement.
Yes.
Hyperbaric oxygen therapy is huge because what we're doing is we're increasing oxygen delivery to cells, right? Hyperbaric oxygen therapy is delivering oxygen to the cells. Mitochondria are taking this oxygen and making ATP, which is energy, right? Yeah. This is the energy that makes us alive. It makes our cells alive. And this is so important. And we're actually, we're seeing this more and more in actually imaging studies that we're doing in hyperbaric patients to see, like especially in stroke patients that have had brain injuries or have had tissue death. You can see around that area of injury is also this area that's sort of hibernating, not working to the maximum capacity. As a result of that, that tissue is just not working. Like we think a lot of the neurologic injury is because that tissue is not working at max capacity. You give it hyperbaric oxygen therapy, you give that tissue oxygen, you rev up the mitochondria, those cells can regenerate themselves. And we can see that on imaging, which is really, really cool.
And isn't it difficult to get oxygen into the mitochondria? I mean, I know to solve that problem for me, I've been sleeping on a magnetic sleeping pad because that oxygen mitochondria kind of work by paramagnetism, and that will suck the oxygen into the mitochondria. But that's now with the HBOT, or I guess you're forcing it into the mitochondria.
Right. Now, the way we're doing that is really because we're just massively enhancing blood flow to the area, right? So it's the blood flow that's sort of diffusing oxygen into tissues. So that's really what we're doing here. But yeah, I mean, those are different ways that, there's lots of different ways to sort of enhance mitochondrial function. Hyperbaric oxygen therapy just seems to be one of the most powerful, right? Because really, it's about blood flow. The more blood flow you can get to an area, the more oxygen can diffuse out of that blood into the tissue, and the further it can diffuse into tissue, to cells.
Yeah, so why don't we talk a little bit about the health conditions that can be treated and improved with HBOT?
Yeah, I like to kind of break this down into two main categories, right? So we have those things that hyperbaric oxygen therapy sort of been approved for in the sense that it's covered by insurance, and then there's a large proportion of things that what we call investigational or sort of off-label that are there's a lot of data behind, and then some of them are coming down the pipe are going to be covered soon. A lot of this has to do with politics, unfortunately, but there's a significant amount of improvement in a lot of other conditions. So the insurance covered indications or the FDA approved indications for hyperbarics, there's a lot of them, but the ones that we treat most commonly are diabetic foot wounds, diabetic foot ulcers. So patients that have these wounds and they're diabetics that are just non-healing, right? Hyperbaric oxygen therapy is extremely, extremely effective in improving the circulation in the blood, like as I mentioned. So what we can do is really heal these wounds. We prevent patients from getting their feet, their toes, their legs chopped off all the time. It's pretty impressive. And we're becoming more and more utilized, and I think that's great. When patients come and see me, a lot of times they've already gotten one or two toes cut off, unfortunately. And I saved that third toe, and they're like, well, why didn't I know about this before? And I think, we need to get that out there. I think the education needs to be out there, not only for patients themselves, but for podiatrists and for vascular surgeons. And that's one of the things that I work on is trying to get that education out there. So that's diabetes and diabetic foot ulcers. There's also a main category, probably the main category other than diabetes, is radiation injury, okay? And when I talk about radiation injury, I'm talking about patients that have gotten radiation therapy for cancer mostly, okay? These patients unfortunately can get significant radiation injuries related to the cancer therapy. They may have no more cancer, hopefully, but they also can have significant radiation injury that can cause lifelong disability.
Yeah, my grandmother, case in point, she had radiation on her breast, and they completely burned her muscle to the point where they had to remove her chest muscle.
Oh my
And
goodness.
yeah, so unfortunately, I think that's not an uncommon scenario.
Right. I mean, they've gotten a lot better at radiation therapy, probably since your grandmother got radiated, but still, there's still a pretty significant complication rate. It depends on who you ask, right? The complication rate is somewhere between probably 5 and about 20%, depending on where we're talking about. Probably one of the most sensitive areas that you can imagine to radiation would be your brain, right?
Mm-hmm.
So, and that's where we see a lot of patients come in my clinic, radiation necrosis of the brain, which is pretty hairy stuff. But hyperbaric oxygen therapy is probably the most it's the most important, it's the most potent therapy for radiation injury. We can cure patients with radiation injury, and I don't say that lightly, okay? But our usual rate of improvement is about somewhere between about 80 to 85% in patients' radiation injury, whether it's in their brain, whether it's in their jaw. One of the most common areas that we see in patients that got radiation to their jaw, something called osteoradionecrosis of the jaw, which is pretty severe stuff. The bone starts eating away itself. It's really unfortunate, but hyperbaric oxygen therapy, combined with some other modalities, is actually very, very effective. Breast cancer, breast radiation, patients that have non-healing wounds related to that, we have significant improvements there. Patients with prostate cancer and radiation injury, GYN cancers, it just sort of runs the gamut. We have so much success treating these patients. It's really quite dramatic. Some other types of hyperbaric oxygen therapy FDA-approved indications include flaps and grafts. If these were done, especially in radiated areas, if those aren't healing well, you can get hyperbaric therapy, very effective. Chronic infections that may not be going away, usually that have some bone infection as well related to it. Very bad stuff. Hyperbaric oxygen therapy is very, very effective. Actually, combined with antibiotics, becomes even more potent, actually, in those particular circumstances. Now, to kind of go over to the sort of the things that aren't covered by insurance, but are also very effective. The top two, I would say, would be traumatic brain injury and stroke. Okay, TBI, we see in this country and around the world, it's the #1 cause of long-term disability in people less than 45 years old. So it's a pretty huge burden of disease, and hyperbaric oxygen therapy is so effective in these patients, okay? And now those studies are being done, and I'm hoping that soon that it really is covered by insurance. The studies are coming, they're out there, and patients are improving in my clinic and around the country. Stroke, same thing. It's being used in rehabilitation settings all over the country, all over the world, excuse me, not in this country. These patients get significantly better with hyperbaric oxygen therapy. And I'm just going to list a whole bunch of other things, because there's so many. Reflex sympathetic dystrophy, otherwise known as complex regional pain syndrome, cerebral palsy. A couple new studies have just been published on the improvements in motor function in these unfortunate patients. Also, different types of headaches, cluster and migraine type headaches, Lyme disease, other chronic infections, Parkinson's disease, Alzheimer's. There was a recent study just published, Alzheimer's or St. John's wort plus hyperbaric, increasing cognitive improvements in patients with Alzheimer's, MS, really interesting stuff going on in MS, rheumatoid arthritis, decreasing inflammation mostly, ulcerative colitis, ulcerative colitis, Crohn's disease, which are types of inflammatory bowel disease. Some really interesting stuff going on in that field, which I think is really great. What other things?
What about burns?
So thermal burns. I didn't mention those. I kind of forgot to mention sort of the FDA-approved indications that are just covered in hospitals. Basically, because if you come in with a 3rd-degree burn, you need to be in a hospital. I don't want you coming to my office with a 3rd-degree burn, please. Right. So I should just mention briefly some of the things that are treated in the hospital for hyperbaric oxygen therapy with hyperbaric oxygen therapy: thermal burns, carbon monoxide poisoning, necrotizing fasciitis or flesh-eating bacteria, gangrene of the foot, acute sort of lack of blood flow to a limb. You can get hyperbaric oxygen therapy. Those are conditions that are usually only treated, as I said, in the hospital, and they're very effectively treated, as I mentioned. that was sort of my initial, my initial experience with hyperbaric therapy. It was just amazing to see the difference after just a couple therapy sessions in those respects.
Do they have HBOT in most hospitals?
So the answer is, I would say about 20% of hospitals have hyperbaric oxygen therapy. In San Francisco, there's two major hospitals in sort of like the, I don't know what you call it. I grew up in New York. It was called the metro area. In San Francisco, I don't know. It's sort of like the overlying area around San Francisco. There's one in downtown San Francisco. There's one about an hour. Even in New York City, for instance, there's I think 2 chambers at NYU, and that's it. Wow. For 13 million people. It's kind of crazy, right? Yeah. So, I think it's really super underutilized. And I think that the tide is changing, and people are getting more sort of, they're taking charge of their health and realizing that, that sometimes doctors like me just don't know everything. And I think that's, I don't think anybody like me should say that we do, So, and I think that's becoming more sort of prominent, right? People are realizing I need to do my own research. And I love it when patients come to me and say, hey, doc, what about this or what about that? And I go, well, maybe I do know about it, maybe I don't. And then I learn more, So I think that's really important, So anyway, so there's so many things that we can treat, we can help with. And a lot of that sort of, as I said, is sort of investigational, but we're seeing such extreme recoveries in these patients. It's really, really amazing stuff. So,
are there any contraindications with cancer? I know you mentioned that some clients that have cancer have some concerns about using it.
Right, that's really important. I get that question a lot about cancer. So there's 2 ways that hyperbaric oxygen therapy sort of with cancer. So the first question is, does hyperbaric oxygen therapy, put you at higher risk for cancer, or does it cause cancer? And the answer is emphatically no, okay? There's been several reviews that have been done over the years, the last one in 2012. Hyperbaric oxygen therapy has no cancer-promoting effects, okay? Most people think, well, if you give oxygen to cancer, it's going to make it grow more. And the answer is absolutely not, actually, because most cancer doesn't like oxygen, actually. Cancer itself is sort of a hypoxic sort of thing. And you give it oxygen, there's some indication, at least in some types of cancer, especially one called glioblastoma in the brain, hyperbaric oxygen therapy can actually be sort of a hindrance to its growth, okay? And that sort of leads me to where hyperbaric oxygen therapy can sort of be helpful in sort of cancer management, okay? And there's a couple different ways. Hyperbaric oxygen therapy is a radiosensitizer, so it makes radiation therapy more effective. So it's being used in some studies right now in the middle of the country and also in the East Coast, using hyperbaric oxygen therapy plus radiation to treat types of brain cancer, called this specific one called glioblastoma, okay? It's also a chemosensitizer too, meaning that it also improves chemotherapeutic modalities because you're increasing blood flow. It's all about blood flow, okay? Yeah. You're increasing blood flow to a cancer or to a tissue that has cancer in it. You're going to improve the amount of therapeutic effect of that, whatever that modality is, okay? There are some alternative regimens that are happening right now. In fact, one of the guys that presented at the Bulletproof conference, his name is Dominic D'Agostino. He just did a recent study on hyperbaric oxygen therapy plus what's called the ketogenic diet. I think probably some of your listeners are familiar with that. Or just, sort of like a high-fat, moderate protein, very low carbohydrate diet, plus hyperbaric oxygen therapy in mice. These mice had metastatic cancer. Their cancer burden, I think, decreased by like 85% when treated both with hyperbaric oxygen therapy and the ketogenic diet. It's a very powerful stuff, right? So it's all coming down the pipeline, right? But hyperbaric oxygen therapy and cancer, they go together well. There's no worry about you having any sort of cancer promoting effect, and I want to be very clear about that.
Okay, great.
So the other thing that you mentioned about side effects, right? I should sort of point out a couple other things. So hyperbaric oxygen therapy is very, very safe. It's been around a long time. It's one of the safest sort of medical modalities out there, I think, really. The only major side effect that we have to worry about in patients is their ears, okay? Like a diver, right? If you go down too quickly or come up too quickly, what's going to happen, right? What happens to your ears?
Yeah, they will start popping, or they can burst.
Yes, that's what happens in the chambers. Same thing, right? So you can rupture your eardrums if you're not careful. But in the chambers, we have much more control than even diving about how quickly you go down, how quickly you come up, and it's very easy for us to prevent those things from happening. Okay, so really, if you're at an experienced place doing hyperbaric therapy, it shouldn't happen. Okay, and I recommend that most patients, actually all patients that are getting hyperbaric therapy, whether it's in a hard chamber and a soft chamber, or a soft chamber, which we'll talk about the difference, they get a consultation with a physician first. Okay, very important to talk to somebody that's going to sort of guide their care. I think that's very important. What your goals are, what your risks are. There are some other things we worry about with hyperbaric therapy as far as side effects, but really the ears is the biggest one, right? It does increase insulin sensitivity, so if you're prone to low blood sugars or if you're a diabetic, you need to eat before you go into chambers. If you have cataracts, it could make them worse, so we just have to know about those before, but it's not going to sort of magically make you cataracts. Only if you had those before are they going to happen. There's some sort of lower, very much more rare side effects that can happen, oxygen seizures or lung toxicity, but these don't happen in somebody, especially at sort of like the more shallow pressures, but that's why you need to have a doctor sort of just assess you and make sure that you don't have any reasons why those would be a higher risk.
Okay. So you mentioned stem cells. How exactly does the HBOT increase stem cells? Because that's obviously going to be very important for tissue regeneration and healing of wounds, etc.
Right. So, stem cells are where it's at, right? I mean, we all know that stem cells regenerate tissue. And hyperbaric oxygen therapy, what it does is it uses a mechanism called nitric oxide synthase, NO for short. A lot of people have heard of nitric oxide, right? It's also sort of what laughing gas, I think, is sort of like one of the derivations of it. So we're not talking about laughing gas here, okay? We're talking about a chemical in our bloodstream, in our blood cells, in the endothelium, or the sort of the tissue lining of our cells, and that produces nitric oxide synthase, which then produces stem cells. These stem cells come from our bone marrow. They actually also are in our fat cells, actually. And these cells migrate to tissue where there's injury, and hyperbaric oxygen therapy makes this sort of migration and the proliferation or even the production of these cells more efficient. So very powerful, especially with combined with a lot of other types of modalities are coming out there. You talked about some magnetic stuff or some light therapy. There's some really interesting research coming out on light therapy. Interestingly, red light is specifically being helpful for sort of stem cell sort of migration and tissue healing too. Pretty cool stuff.
Yeah, well, that's what I offer people with the near infrared saunas.
Oh, there you go.
They get red light therapy with that as well. It's another benefit of them.
Right. So stem cells are key, right? And there's some research being done now, or I'm actually working on an IRB or a study design with a couple colleagues about working on sort of stem cells plus hyperbaric oxygen therapy for traumatic brain injury, which is pretty cool. So we're hoping to get that started at some point.
Okay, so what are the costs of doing a hyperbaric oxygen therapy session?
So it depends on what kind of therapy session we're talking about, right? So there's soft chambers and there's hard chambers, okay? At my office in San Francisco, and I'm affiliated with an office in New York, we're mostly using hard chambers. These tend to be a little bit more expensive because they go to deeper pressures. So for the hard chambers, we're talking about anywhere between $100 to about $350 per session, okay? And then there's different types of hard chambers. There's single chambers called monoplace chambers, and there's these sort of communal chambers or multiplace chambers. And those are chambers that you usually see in hospitals where you can treat multiple patients all at the same time, okay? And those chambers tend to be a little bit less expensive. It's sort of like, you have more patients being treated at the same time. It's less money per patient being treated, right? So it really ranges. And then, as I said, sometimes this is going to be covered by insurance. Sometimes it's not going to be covered. And depending on the indication. So if it's not going to be covered by insurance, if it's sort of an investigational indication for hyperbaric therapy, then we're talking about that's the price that you're going to be usually being charged, $100 to $350. Okay. If it's FDA approved, it's covered by insurance. Then we're looking at somewhere anywhere between $1,000 to $2,000 per session at a hospital. Okay, but most of that should be hypothetically covered by your insurance company. However, if you did get treated at an office like myself, like my office, or like the office I'm affiliated with in New York or around the country, it's going to cost you less money, most likely out of pocket, because our insurance, these days you have these huge deductibles you need to pay before they start covering you and everything. So something to be aware of. I would recommend if you can get outpatient therapy for hyperbarics, you should get it in an outpatient environment, right? Okay. Because it will end up costing you less money in the long run, even if it's covered by insurance, right? And it's probably nicer to get treated in a clinic, not in the hospital, if you can avoid it. So.
And so how long are the sessions? Are they 10 minutes, 30 minutes?
Right. So the session length, the shortest session length is usually about 60 minutes, okay? And the longest session length is usually about an hour and a half, okay?
Okay.
And so this is, it sort of depends on what we're doing here, right? But the idea with hyperbaric oxygen therapy is it's not just one treatment session. It's usually a series of treatment sessions, okay? And these occur over a contiguous amount of time, meaning that oxygen therapy, hyperbaric therapy is a cumulative process. Taking our DNA and changing it takes time, okay? And this occurs over sessions that are done in a row. So we're talking usually therapy sessions done sort of Monday through Friday with the weekends off. Depending on the indication, it could be anywhere between 2 months to more of therapy. And so it's a pretty significant time, it's definitely a time commitment, right? So, but for some indications, for some things that are sort of acute, like acute injuries, possibly some sort of things like, some new sort of investigational protocols like cognitive enhancement, you may not need as many therapy sessions in a row to get there, right? But you do need some, okay? Now, what I think I forgot to mention, one of the indications for hyperbaric therapy is pre and post surgery. It's investigational, but what we can do is improve healing after surgery. You get one therapy session before, and then you get 4 or 5 afterwards. And you can increase or basically decrease your healing time by about 50% under most circumstances. So pretty significant healing time improvements. We get, patients on the field. We treat athletes all the time, So the protocol for these guys is usually less amount of time, right? So it's not as many therapy sessions, right? And also the protocols change depending on what kind of chamber we're using, if we're using a hard chamber or a soft chamber, right? So I think this is a good time for me to talk, if you're okay with it, about sort of hard and soft chambers a little bit.
Yes,
is that okay? All right. So hard chambers, I don't want to confuse everybody. So that's, hard chambers are chambers that are made of sort of hard acrylic glass. They can go down to as low as about 6 ATA, right? Which is pretty far down. So soft chambers are usually chambers that you can't have 100% oxygen in these chambers, okay? It's just compressed air, and they can go back about to about 1.3 to 1.5 atmospheres of pressure, and that's about 15 feet of seawater at the most, okay? So they treat hypothetically different things, right? The soft chambers aren't really approved to treat anything right now except for acute mountain sickness, right? So if you go up high in elevation, come down, you get terrible symptoms like you can get pulmonary edema or lung fluid, you can get headaches. You go into these chambers, these soft chambers, it goes away immediately, right?
That's why I do not climb mountains. It's very dangerous.
Yeah. Well, you can train yourself, right? Like anything else. But yeah, those symptoms can be severe at times, right? Depending on how fast you go up, what your conditioning is like. So those chambers, they can't go as deep, right? And then they can't get 100% oxygen in them. Now, I have to say, if anybody tells you that then these chambers can be, converted to go deeper, or they can have 100% oxygen in them, please run, because it's just not safe to do if it's not being monitored in a medical setting, okay? Because these chambers, the soft chambers, can be used at home, which is nice, right? The hard chambers can't. They have to be used in sort of a medical setting like where I practice, where you have your certified hyperbaric technicians, you have me supervising, you have PAs and MPs, you have trained staff, okay?
At the Bulletproof conference, the other guys, the booth next door to yours, had the soft chambers. They had 2 there, letting people check them out and try them out. They actually rent them, or you can rent them in your home for $700 to $2,000 a month. So a little bit pricey depending on the model that you want, but I thought that was really interesting.
Right. So I think the real role for these soft chambers is probably, we don't know for sure yet because it's still investigational, for sort of long-term management of neurocognitive disorders, okay, and neurocognitive inflammation potentially. And what I mean by that is sort of central nervous system processes like traumatic brain injury, stroke, MS, and possibly cognitive enhancement too. We just don't know yet, but all indications kind of point that these indications don't need as much oxygen, right? So you don't need to be in a 100% oxygen environment, over the long term to give yourself some benefit. The initial hyperbaric treatment, though, needs to be, I think, at least in the chambers that are sort of hard acrylic glass, sort of more monitored while you're getting therapy, for the sort of acute run of hyperbaric therapy, acute sort of session, And then after that, sort of long-term management, maybe these chambers in the long run, right? And also with these chambers, these soft chambers, you can't get down as far, right? The depth isn't as great, the pressure isn't as great. So, wound healing, things outside of the central nervous system, like like a diabetic foot ulcer, or sort of arthritis-like symptoms, or even though it's sort of investigational for hyperbarics, you can't really get down to the pressure that you need to really decrease inflammation outside of the central nervous system, right? Okay. So I don't think that these chambers are going to be very helpful for things that require you decreasing inflammation outside of your brain and spinal cord, truthfully. Okay. But I mean, I think that there's definitely going to be a role. We just haven't sort of completely figured it out yet.
Yeah. So say someone is trying to just do some anti-aging or improve cognitive function or increase their chondrocytes. How often should one do? How many sessions does one need to do to improve that?
So anti-aging, right? So it's such a big category. But what I usually say is that hyperbaric oxygen therapy is anti-aging, right? And the reason why I say that is that we're healing wounds no matter where they are, right? If they're in your brain, if they're on your toe or your finger, we're healing. We're helping the efficiency of that healing process, right? I think, as I sort of mentioned, right? So when we're talking about sort of brain health, right? As we get older, if I put somebody in an MRI scanner at 50 years old, what it's going to start showing is what's called microvascular ischemic changes. What that really means is that your vessels start deteriorating, and your mitochondria to start deteriorating as well, right? Because if the vessels start deteriorating, the cells around those vessels are going to deteriorate as well, right? So I think what we're doing really with hyperbaric oxygen therapy is regenerating that stuff, right? We're regenerating those vessels, we're regenerating, tissues that are injured, and sort of injury comes with age, right? Now, for the people that have no issues, right, which is very, very few of us really, and this one sort of cognitive enhancement, I do think that hyperbaric oxygen therapy is going to play a role there. Now, there's no studies right now. It's still very investigational, but we do know in patients with stroke, with traumatic brain injury, even patients with diabetes getting hyperbaric oxygen therapy with normal pressures, feel like their cognition gets better. And we're testing this in the TBI world, in the stroke world, using sort of something called the neurocognitive testing, or impact test is the most common. And we can see how their cognitive abilities improve. And then if we look at their brain under a scanner, we look at an area called the hippocampus. And the blood flow in the area of the hippocampus is just dramatic, even in patients that don't have injury there. So the idea would be, the hippocampus is getting more blood flow. Why wouldn't it do that to regular people that don't have injury as well, right? Yeah. So what does the hippocampus do? It's basically an area of our brain that's extremely important in sort of making short-term memories into long-term memories. It works with our sort of executive function as well. So I do think there's a role. So for that kind of protocol, we don't really know yet, truthfully. But I think the idea is that you need some sort of protocol, somewhere between 10 and 20 treatment sessions, and then sort of long-term management. In sort of like one of these sort of maybe these portable chambers might be helpful, right? To sort of maintain that. And I think that's where, when we're talking about neurocognitive issues, we're talking about maintenance for a lot of these things, because they're degenerative processes, right? You degenerate over time, even if, you're not in the chamber or whatever, even if you're doing everything you can. So that's where I think where we're talking about with sort of anti-aging, and, we're healing wounds. That's what I'm doing in hyperbarics, right? And I think that's the protocols that are sort of coming out. And it's not only just about hyperbarics, right? It's about, dietary interventions. It's about, it's about all the things that you do as well, Wendy. So, it's a combined effort, right? And I think hyperbarics is just a very powerful adjunctive, most likely in that respect.
So how often do you do those sessions?
So, I'm a busy guy. I wish I could do more than I do, Yeah. But I've done, protocols of therapy, and just, because it's really important for somebody like myself to have an idea of what patients are going through, what they can expect. I've had my staff members go through some investigation protocols too, for cognitive enhancement, actually, just to see if it works, right? And it seems to. It really does. This is all sort of anecdotal, and I can't sort of, I can't recommend as a medical physician for you to do this because I just don't know, But the idea is that there is probably a role, right? And I try to do it as much as I can, right? I don't have a home chamber. I don't have a portable one.
Yeah.
Maybe I can get these guys to give me a free one, but because they're expensive, right?
Yeah, they are. Yeah.
But I think, if you can maybe, I think, maybe there are Groupons for them. I don't know.
Yeah,
Groupons
there
for
is.
them.
I was going to say that my girlfriend actually bought a Groupon for
Oh, no
hyperbaric
way.
oxygen chambers. Yeah.
So then, maybe you guys could share them and like, work on them as sort of like, together.
Yeah, I'm going to go look for it again, see if it's still available and try it out.
Yeah, I could see like a way you could like rent them, and then you have like a party or something.
Yes, yeah. HBOT party.
Yeah, again, make sure that if you're going to do that, though, again, everybody needs to be evaluated by a physician before they go into a chamber, even if it's a soft chamber, please.
Yeah.
Okay.
Yeah. Well, you have to come down to the party and oversee it.
Oh, well, if I'm getting invited, then maybe I'll
Yeah.
come and check. Yeah, sure.
Well, I have a question I like to ask all of my guests.
Sure.
What do you think is the most pressing health issue in the world today?
So, well, it depends on who you ask, right? For me, I wouldn't say Ebola, although that's on the list
Yeah.
for a lot of physicians and especially patients these days. For me, it's the things that I treat, and I think two of the most just potent. Yeah, just the ways that hyperbaric oxygen therapy can help the most in patients with traumatic brain injury and stroke. TBI, veterans coming back from Iraq and Afghanistan, even Vietnam vets. I see all these patients in my office. As I mentioned before, it's the number one cause of long-term disability in this age group, like less than 45 years old. It's these guys can't go to work. They're on all these crazy drugs to prevent them from having suicidal thoughts or drinking. They're alcoholics. It's really bad. In NFL, we're seeing domestic violence. We're seeing these guys die early. CTE. It's all related. And hyperbaric oxygen therapy is just so effective in these patients. I haven't seen a patient in my own personal practice that hasn't improved. That's not to say that everybody will, but I mean, it's really just effective. It's really so amazing to watch. And we document this stuff. We document them on, cognitive scores. We document them on sort of activities of daily living scores. I mean, we do all this. We document it because we want to tell people, we want to show them, the world that we can be helpful here, and this epidemic, not even in just, adult, pro athletes, but we're talking about in kids now and, young soccer players and these concussions that are happening and these are causing long-term issues. And I think that hyperbaric oxygen therapy is just going to be so important in just the healing process for these patients. It already is on a small level, but just the burden of disease is just so high, right? And one of the reasons I'm so happy that we got to talk today, Wendy, is that I think almost everybody knows somebody that's had a traumatic brain injury, right? If it's not a TBI, they know that somebody that's had a stroke, right? Strokes, number one cause all ages of long-term disability. And the studies are being done, and they're really, I think indisputable in many ways that these patients are getting better. And these are patients that have had stable symptoms for a while before they get hyperbaric therapy, and all of a sudden they're doing things that they couldn't do before. Now, is it always dramatic? I think it depends. It's in the eye of the beholder, right? If you couldn't, toilet yourself, and now you can, is that a big deal? I think that's a pretty big deal, right? So again, we're not always talking about dramatic changes in sort of like the bigger sense, but in the smaller sense, if you can prevent somebody from having headaches every day, if you can get them, start moving a couple of their fingers instead of none of their fingers, I think that's a pretty big deal. And that's really where I see hyperbaric oxygen therapy as being sort of the wave of the future, right? It's sort of like the past because it's been around forever, but it's really the future because I think it's really going to be effective for these guys. I think where it's going to start, it's going to be a grassroots thing. It's going to be patients demanding, that they have access to this. And this is actually happening in some states. In Oklahoma, for instance, there was just recently some legislation passed trying to get hyperbaric oxygen therapy for veterans coming back from the wars, right? I have to turn these people away because I can't treat them because I just, it's just too much money. They don't have enough money and I can't treat everybody for free. I wish I could, So I'm always out there looking for, for patients, and also I'm always looking for patients. I always want patients. But I need people that have the funds and have the wherewithal to say, I want to sponsor people. I want to help them, and not just, TBI patients, but, stroke patients, patients with RSD, patients with, with cerebral palsy. There's just a huge burden out there, and I know we can be helpful. It's just a matter of just getting them treated.
So how specifically does HBOT help RSD? I have a friend that has RSD. And how specifically would it help a regional pain syndrome like that?
Sure, yeah. So what we're seeing is that, RSD is basically a neurologic injury, okay? What happens to the nerve itself, no matter where it is, if it's in the arm and the leg or whatever, these patients have sort of a dysregulation of their nervous system, okay? And they have swelling, they have inflammation. And what hyperbaric oxygen therapy is doing, we think, is it's decreasing the inflammation, it's decreasing the swelling, it's allowing that neuron to repair itself, to recover, right? And especially if the RSD hasn't been present for a long period of time, there are some pretty significant improvements that I've had in patients, right? They get dramatically better. And there's some studies to show this is the case. I mean, they're not gigantic studies, they're not thousands of patients, but really, I mean, the only place that I've had some trouble treating patients with RSD is if it's sort of a full body RSD. If it's a localized area of injury, I have a lot of success. But if it's sort of a generalized RSD, which are less common, but they're much harder to treat. And the other thing is that, and this kind of goes along with every indication for hyperbaric oxygen therapy. Truthfully, the shorter time it's been since the time of injury, the more effect and the more complete effect that we can get for the healing process, no matter what we're talking about.
Well, Dr. Sherr, thank you so much for coming on. That was so good, and I hope the listeners out there start demanding your HBOT therapy and
talk to your congressman, or just talk to me, or talk to people that are around you. Google is great. It's a great tool for you, right? Yeah. Or whatever else.
Yeah. So why don't you tell the listeners where they can find you and where you practice, etc.?
Sure. Yeah. So the easiest way to get a hold of me is through my own personal website. It's called integrativehbot.com, integrativehbot.com. And I have two major affiliations. I work in San Francisco. That's where I live, at the San Francisco Institute for Hyperbaric Medicine. I also do consulting work and work on the management side at a hyperbaric oxygen facility, actually two facilities in New York. That's where I'm from. And they're about to open up a center in New York City, which is great too. Obviously, as I mentioned, there's like no chambers in New York City, and there's a huge need. And I'm really excited about that. So you can go to my own personal website. You also can follow me on Twitter at Dr. Sherr, DrSherr. Or you can go to the websites directly, but just go through my website and, feel free to email me anytime. I'm a pretty accessible guy, and I'm here to help. Even if you're not in my areas, I can help you find people to get you treated. I know people doing this in LA, in Colorado. I just talked to a really interesting guy yesterday, actually. I'm always talking to people. I'm especially interested in hyperbaric guys that are doing this from an integrative point of view, and I can point you in those directions if needed.
All right, great. Well, thank you so much for coming on the show. That was so good.
Wendy, thanks so much for having me, and it really was a pleasure.
And listeners, if you want to learn more about me, detoxification, how to heal your health conditions naturally, you can find me on live to110.com, and you can download the free Live to 110 by Weighing Less e-guide. I've got a few free ebooks on the website if you want to sign up and get email updates. And please leave me a review on iTunes. That helps people find my message, gets me higher up in those search engines so people can listen to the show.
Google search.
Yes.
Search, yeah. Need to be on top of the Google search.
Yes. Yeah. So, listeners, thank you so much for listening to the Live to 110 podcast.
Bye-bye. Thank you.